So welcome and good morning, folks. Today we'll be doing a quick presentation on a subject that has to be the foundation of medicine and the foundation of what later is put into question when things complexify and too much money gets involved. So a guide for physicians navigating moral choices in modern medicine. But let's make it simple. Let's keep it straight to the facts and let's do something. This has nothing to truly do with being a doctor. It has everything to do with being just a normal and a good human being that in the morning when you wake up, you feel happy, not just about the day that went by, but about the day that you are at today and what's coming up into the future. So you need to protect this identity, which is not truly an identity, but it's the act of honoring your beliefs. And we're going to talk about those beliefs because there are some beliefs that are within the human species, which is found in all people, women, children, adults, old people. They all have it. So this is what we're going to be trying to protect. When we say I became a doctor, I became a firefighter, I became a banker, I became a lawyer. The ultimate thing here is that you're going to try to help this thing that exists within yourself, this sense of morality. And so it's something that is very often forgotten about in medicine. And then this is when medicine starts becoming like a justice type system without compassion, with the desire for fairness, I need to be respected, and all these ideas that then creep into our thoughts, but truly are the manifestation of anger and victimhood to some degree. The right word is not victimhood. It's not a lack of love, but it's a lack. There's a lack in that person. And so they desire something as a consequence of something taking place, right? So I see something, it disturbs me, I want and I need justice. And it's a little bit like you seeing somebody being abused. It's going to rile you up. It's going to make you even try to participate, to get involved, to change what's currently taking place. So it's about revindicating an existence that is immutable, that cannot be changed, that cannot be perturbed or corrupted, and this is where physicians have a little extra work to do. It's not just that, you want to help people. No, it's not. You want to help people, but you need to become somebody that can truly help, not somebody that's going to injure other people. So having the right mindset will help you do that. So to have the right mindset, you need to have the right values and you need to protect the right mindset itself. So, all right, let's begin. So why say this now? Lots of physicians are experiencing burnout, moral injury is rising, ethics compromise for efficiency. This is what AI comes with. I'm not coming to you with what AI has. I'm coming with you with common sense and to some degree pulling back. You need to pull back. This is something that doesn't need to be said now because the situation is bad. This is something that needs to be said now because what it does is good. So see the difference. It's like saying, yes, every day it rains. Yes, every day it storms. Every day you gotta pay taxes. What do you have to do every day? Every day you gotta work because paying 0% tax on $0 also means you're gonna be starving. So the foundation on everything else that you build, of your relationship with other people is not really that you're a doctor, because people don't just want to see a doctor. They want to see an outstanding individual. They want to see somebody that's compassionate, somebody that's intelligent. And to some degree, they want to be guided through processes. I will tell you that a lot of in the conversations that I am caught up with people, even outside of medicine, like what you have as a doctor, as far as medical knowledge, helps you. But a lot of the times people have problems in their lives that has to do with not knowing how to live. They don't know how to react to the world and they have no peace. So when conflict shows, they go back on this fight or flight type system. And this is a very, there needs to be type system, and it doesn't let for flexibility. So it tries to control people all the time. So the more you learn about this reality of communication of within people, right? The more you bring this into light within yourself, you will also see that if you're not ready mentally to engage in a conversation with somebody that has an ear infection, this can turn into a hellish ear infection. So this is what's going to allow you to profess not just as a doctor, but outside of the medical field. It's keeping your life simple, keeping yourself simple. It's what you had prior to becoming a doctor that was a good thing, who you were at the base as a child. It's that identity, that individuality that has grown throughout your life. But, it's like there is a certain, like a very good nature that you see in children, which is they're at peace with everybody. This is what I'm talking about. And this is something that is actually an intelligent position. If children would be as belligerent as people are after being destroyed by life and stuff, their chance of survival would be lesser. Let me say that again. Children have built-in high tolerance level to BS that allows them to get along even with parents that aren't so good. This increases their chance of survivability. So this increases their chance of getting along with people that even dislike them. Why? Because the children don't take things personally. Not all the time, that is. So it's about now using that intelligently to be in this world, not of it, but not get wrecked. And not being skilled in understanding where other people come from will often cause that just simple things will turn to bad. And they will turn to bad because there is no justice here. There is no fairness. At the end of the game, there's a huge power deal. And so the more you know it's like the more you know about other people, the more you will be able to interact with them in a way that you are not, it's like saying, I would dare say that physicians are well-intentioned for the most of them. And you also need to protect that well-intention, because if not, you're going to have conflicts that arise whereby you're going to help people, things turn to bad, and then what? Then you don't want to help people anymore. Now you just want to do your job and get it over with. That is a failure, not as a doctor. That can even be positive as a doctor, because some physicians may be too emotionally involved with what they do. This is an ego thing, right? Maybe you're doing medicine because it makes you proud. So if your goal was to help people from the get-go, then you need to learn these skills, because it's like trying to save somebody that's drowning. They can also drown you. So after you see a bunch of people die trying to save people from drowning, what do? If you don't have the means to float, you could be sunk down and killed. So now the knowledge which I'm trying to share with you is that safety, floating device, or that rope that you throw to these people so that you don't get sucked in and drowned in the process of trying to save them. That being said, all right, let's continue. What this is not. So a lot of what you see today of the dialogue of people, that you see in the political spectrum is a lot of this hurt. I am hurt. I have been deceived. I've been cheated, which is also the victimhood of Satan. You remember, Satan tells God, you wronged me. So the problem here is that when people take that attitude, it's like they are actually relinquishing away all form of free will. In a sense, they say, I have no free will. You are the cause of all this. So in that, imagine we do that to each other, whereby a patient says, it's not my fault at all, or a doctor says, it's not my fault at all. Imagine your children said, it's not my fault, you are this. So very complex things, because we're talking about dynamics, right? We're talking about the dynamics of, I don't know, why did this like 15 minutes into it started to take notes, or asked me to take notes. So I see that because I see the political spectrum. I see a lot of people fixating themselves on personalities, and they forget. So to some degree, they're pointing in the right direction, but they don't actually ultimately get to the point of it, like the purpose of the messages. They don't actually understand what I consider to be part of the message, which is that you actually have responsibility. So one of the great tools of conversation is to not conversate. It's to be selective about what comes out of your mouth. When you see people are smoking, this is a skill set. And when I mean smoking, I mean they're red raging. They're about to blow up. They start losing their respect towards you. They start giving sarcastic or sardonic comments, cynicism, passive-aggressive behavior. You need to do two things. You need to cut the communication immediately, number one, because this is a sign that you didn't see this coming. If you did not see this coming, it's because you are not aware of where you are going into in a conversation. Let me give you an example. A patient says, I came here for renewal of my narcotics. And you're going to say no. For whatever reason, you decide to not refill their narcotics. Then they get angry. So now you are not listening to the patient. You're making them waste their time. They'll give you these comments. This, you see, by the way, you see it, every physician has seen this in their career. It's not a thing about physicians. It's about not getting what you want. This is also spoken about in the Bible, or in reference to Satanism. Satan tells God, I will go to them from every direction, and you will realize that most of them are not grateful. There's also a comment in the Bible about ungrateful people, wives in the Bible. And the comment goes to the rounds of, you've never done anything for me. The second people don't get what they want, they say, you never have done anything for me. So this is the imbalance in relationship in the world of physicians, that people can behave like that and you have no recourse against it. You can protect yourself from such behavior. Now, the way you go about doing that is that you don't let these people live a fantasy that exists in their mind during your medical encounter and practice. So what this means is that communication needs to be done beforehand, before you see the patient. In other words, if a patient is not going to be refilled narcotics or benzodiazepines, Ativan, and all that at your medical practice, they need to know beforehand. And this is what you need to know as a doctor. There are communications that you cannot have with people right now at this moment. It has to be said way before, because this is why they say the things they do say. In other words, they are not complaining to you, they're saying you're doing your job. Okay, they accept that. But your job was also to let me know beforehand, so I wouldn't realize this here at this place right now. So this is what is actually being held against you. In other words, clear message beforehand. So this is what does not exist in medicine. There needs to be a triage type of system of communication that immediately flags you as, this is not done at this clinic. We do not do this. I came here because I wanted to get an x-ray done. Sir, we don't have an x-ray device at this place. Well, why the hell did you give me the appointment? So technically, you can then reply, well, you're supposed to know what we offer at the clinic before you come here. Wrong, right? So you already see what's happening. The truth is not an element of communication, because it can be used to pervert things, to destroy things, and quite frankly, destroy people. It can be used as a knife to hurt others. So don't deceive yourself in that when people are disrespectful or hurtful towards you, saying the truth to them is not actually communicating. It's actually reciprocating in what hurt the other person. Let me explain that again. It's indirectly incumbent on you that you actually have a conversation that is meaningful with people prior to having a conversation that is objective and straightforward. So there needs to be some sort of triage type system for this to be avoided. So it's like this. So let me give you another example. The College of Physicians here in Quebec created a message, a PDF, a booklet on the practice of aesthetic medicine. And they are very clear in there that one of your most important jobs as a doctor is to dispel false expectations. Imagine, in the world of aesthetic medicine, dispelling false expectations from people. Because the problem is, people pay, they're attached to their money. You know how much they had to work to save for whatever procedure they're getting. And now ultimately it's a disappointment. And then you tell them, yeah, but I told you that there could be scars that come from this procedure, or I told you that you weren't. So what you told them doesn't negate the fact that they romantically fell in love with an idea, and they are going to you not for the surgery, but for their idea. So this is why ultimately I decided to leave the practice of aesthetic medicine, because it's not that alone, but to some degree there is a naivete in people that can subject them to one things in a childish way, in an immature way, and it's not a bad thing, but it's just, it depends, I guess, who you are. I didn't see myself in it too much. So going back to the conversation. So how do you prevent these things from taking place? You need to have beforehand. So I'm asking you right now, what are the things that you do not do? What are the things that you do? And here's the problem. One of the easiest ways to practice family medicine is to actually have your established clients, your established patients. You know their problem. They know what you offer. They know what they can offer. They know what they can get from you rather. These are, they know what you do, therefore they can get you clients. Like, well, this guy does this, go see him. They know what you don't do. Actually, I've been there to that clinic. They don't do that. And they have, let's say, a clear list of services. So I use RepeatMD for instant HPI, and I love RepeatMD because they're very clear about that. And they're very patient friendly, and they're very, I guess, in sync with society today. Aesthetics are important, showing things that are beautiful to patients are important, but the clear communication cannot be sacrificed for beauty. So here's the difference. Let me give you an example. There's a lot of people that will sell you crappy products with excellent presentations. People are going to buy it. The problem with that is that this is a money-centered approach. So the money-centered approach is not bad in itself, but it's truly a perversion of medicine. And it's a perversion of simplicity. This is the problem. Simple things are perverted for the sake of promoting something that's not in order to make money. So we sell the dream. Let me sell you the dream. So that's it. Let's just continue now. The forgotten standard, do no harm. So yes and no, simplicity remains simple. So people at any given point in a conversation, they are a jumbled up set of frustrations that they drag in the past. And this is like somewhat of the devil. So you have to, when you talk to somebody, you're also talking to their devil. When you speak to someone and they leave, they start listening to their thoughts again. So when you talk to them, you take them away from their thoughts, you bring them to the present moment. The second they're alone again, the thoughts kick back in. They start dialoguing with themselves in their mind. So you have to realize part of what you say in a conversation can be used, not just against you. It can be used against the individual as well. So this is why written forms of language are superior to verbal forms. It's because if people don't have the mental acumen, they're going to be destroyed and messed up. So there are skill sets in communication that relate to speaking the truth. Speaking the truth is not just a skill set, it will actually purify how you communicate with people. After you speak the truth, either through prayer or meditation for a very long time, you start getting a feel of what the truth is and the sense of it's obvious. So when you hear people speaking without that smell of it's obvious, you realize there's something wrong with their speech. I know you don't get taught this in any school out there, but this is the result of intense prayer and meditation. Prayer specifically. Prayer will simplify your communication with other people because when you pray, you are meant to say what is true. So by building this lattice work of truth like a net, when you will catch big fish, only little fish, which are the truth, simple and clear, will go through those little holes of the net. It's meant to catch the big fish. So when you see somebody lagging in a conversation, either they don't understand, they're going repetitively back to the same thing, it's because they're into their thoughts. They don't know what they're saying. They don't understand. They cannot understand what you spoke. And so their confusion then is like they're stuck in a net. Have you ever seen a fish stuck in a net? It's going to fight. So these people, when you stick them in the simplicity net, they start to struggle. And so you need to let them get tired. Do not try to catch a fish while it's struggling, because then your hands make them feel like you're actually struggling, strangling them on top of the net that's already restricting their space. You need to give them space. People need to then fight, say whatever they have to say, and you go back to your simplicity, and then you reply on your simplicity. Your simplicity will actually tell you, is this the obvious thing that I should say? And then when you feel like, man, this is just such a simple answer, that's the answer that you're supposed to give them. And that way they get reset free from the net of their own thoughts, which they brought into the conversation, from all the frustrating things that they brought up in the past that doesn't allow them to be in the present moment wherein you're having that conversation with them. So this is a gold standard for communicating with people that do not pray, that are confused, that are suffering. The suffering is directly proportional to the lack of prayer, which is directly proportional to the mind, to what degree you are invested in your thoughts and how much have you been dragging out for so long. So when you talk to people, this is primordial. This is very, very important. All right, so going back to where I was. So people come to you from different backgrounds, different pasts, different parents, different religions. But the thing that unifies everyone that you will see is the truth. They don't come to you for falsehood. Human beings do not go to get help from people that they don't trust. So they're looking for trust, and in trusting is the word truth as well, because the only thing you can rely on is the truth. So I'm going to you to find out the truth that I don't have, either because you have the medical knowledge, the scientific education, the objective truth, or you have the tools to find out what's wrong with me. And then even if you don't have a cure, because I need to be basically told what I have, it's going to reduce my stress. If even if I know, well, this thing has no cure, at least I understand why I'm suffering. So people are looking for this truth, which is alleviating, right? So even if you don't have the solution, but you have the explanation, which is the truth, that's what people want. At the base, that's what people want. So being at peace with yourself is number one. Simplicity dictates effective communication. So the lack of simplicity is portrayed in a people that cannot articulate, they cannot put a sentence together. If your patient cannot put a sentence together, this is extremely important for you to understand as a doctor. When you speak clearly, where does it hurt? And the patient goes like, well, listen, it's been a while. It actually started here and then like it moved there, but like I did this and then that kind of made it go away. And then this is actually a very realistic answer. They understood your question and they are framing it now in a way that fits everything that they are. And they think I am also these thoughts. So therefore I will give this to you. This is why it loses. When I say, where does it hurt? I'm not asking about the history of the pain. So the lack of clear understanding of what you're doing, and we're going to do this later in the future. We're going to have conversations with people. We're going to do it live. We're going to stream it, and I'm going to show you. Like, this is actually a skill set. And the skill set is you literally asking the patient. That's not what I asked. So they need to be caught up and go like, wait, what? And then ask them, what did I ask you? And they'll be like, I asked you like 15 seconds ago. I don't know. I mean, I saw that you gave me an answer, but I'm just asking you, what did I ask you? So to the degree that a patient is minimalistic, simplistic, and simple, not minimalistic, simple, they can tell you exactly your question back. So this is a great tool to ask the patient, what did I ask you? When you see, so this is even better, and you will see the perplexity of a patient in a direct face-to-face communication when you do this. I am telling you, this is the offset, the byproduct of praying. If you do not pray, you do not see this. So you need to bring people on the same level, on the level of clear understanding of what is at stake. Absolutely. Because if not, what happens? You give them information, but you're speaking to somebody that's like 50% there. The other 50% is in their thoughts. So eventually, when they are alone, this starts intermixing, and it just leads to confusion, people taking their medications inappropriately, people not understanding what you're treating for them. So proper communication does not take time. What takes time is bringing people on the same page as you are, understanding things in a simple way. This is what will protect the bond of trust between you and patients. It's not what you say, it's how you say it. How you say it must have the experiential understanding of where they're coming from. Their suffering is related to the lack of prayer, not just the physical illness. It's primarily the lack of prayer. I am speaking now of mental suffering, agitation, overreacting. It's the end of the world, my knee hurts. This is pure and simple thought, verbal, self-change, self-modification. The destruction of the human being through the process of thinking, the ruining of a good experience. You're watching a movie theater. Oh man, my money's not right. Man, this sucks. The whole movie. What's the story? Man, I don't know. I couldn't watch the movie. I wasn't focused. I couldn't concentrate. Why did you go? So it's like, if you have money problems, why did you go to the movie theater? Why didn't you go work? Can't you work more? They can't, because the thoughts are stopping them from working. So the problem is not in it. You see, if you tell somebody in a situation like you lack money, you need to work more. They can't work more because they're already in their thought working. They're busy. So it is primarily and extremely important in this particular case that you understand where your patients are coming from, because on top of physical illness, there is mental illness, which when you give them information can ruin the situation for them. If they're not there fully there, and if they are there fully there, then do you really need to give them the information? Don't they already have the solution to the problem? Doc, I've been putting my elbows on the table a lot lately. I don't know for what reason, but my elbows hurt a lot. What can I do for it? You already know. And most importantly, they already know. So we always have to catch ourselves from, let me give you another example. And now this is a personal example, and I'll show you how, in my case, I need to even work on this myself. I gave a treatment to my mother using a technology that uses electromagnetism. And so she had to take some jewelry off. And so afterwards, she was expecting me to help her put her jewelry back. And I didn't have that initiative. And so she had to tell me, can you help me put this? So there is in that people may be expecting things from you, and you are supposed to, it's almost like you're supposed to dance with them. They're not verbally telling you. They're just expecting you to do it. They may be just struggling, but you're not noticing. This is considered a miscommunication. I'm struggling, you're not noticing. How can you not be noticing something? So can this also happen in verbal communication? So it's not about just being sensitive enough. It's about being there and not being there. It's about being sensitive, but it's about being thoughtful. It's about being all these things put together. And you work on this and you develop these skill sets. So I have a lot to learn myself, but I'm sharing you this because to me, when I realized that it would have been better that I help her without her asking me, to me, that was like everything became clear at that moment. What became clear was that I wasn't being observant enough, or I had taken something for granted that allowed for that thing to take place wherein she had to inform me, can you help me out for this? Why wasn't I doing that before by myself? So this is part of my personal illness. So this is what you need to work on yourself as well, looking at your own examples in your life. These situations reveal what's wrong with you. And then you know, well, I have to work a little bit on that. So how do I fix that? I don't know. But now that I know that I wasn't as thoughtful or as paying attention, now I know I need to pay a little bit more attention. I need to be more on my guard. And it may be that some people are very skilled, they're always attentive, some people are not. Maybe I'm too concerned with other things. Maybe I'm too focused on other things. So this is the process of self-inquiry, and you use that to attain the goal of clarification, clarity, knowledge, All right. So the forgotten standard, first, do no harm, truth over image. So truth over image, false appearances, honest assessment, better outcomes. So truth over image. This is the bane. The problem in aesthetic medicine is not, it's like saying the problem is not ugliness. The problem is money. Money. Money, 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 money. Here comes the money. What destroys the aesthetic medicine process is not, it's not, so it's the money that the physicians want, number one. Because if you could help a patient, like get beautiful, become a better version of themselves. Do we not do that with yoga, promoting meditation, promoting prayer? It's the same thing, but it's just physical. So that's not a bad thing. I don't consider that to be a bad thing. A bad thing is cheating a person that may look okay and then be like, well, I think you should get some Botox here, maybe a few units here as well. And you got to do that every 3 months. And you actually don't care about it deep down in your heart, and it's like, I need to get paid. That is a complete, it's not a human experience, by the way. That is a form of anger and hatred that we have tolerated in society against people, which is to manipulate how they feel about themselves so that we can get richer. And unless you are sophisticated enough to realize where people are coming from, that you don't see that they're completely empty, how the things they talk about are lack interest. It's so boring. Nobody cares what they're saying. If you don't see that at the base, it's like saying, do you know who your dentist is outside of the dentist room? Do you know who your doctor is outside of the office of a doctor? If you don't, then you don't really know why the hell you're going there. So you're actually trusting what you received, because what is what you received? That society is doing everything for you. This guy got a degree. He now has a license and a permit from the government. It costs me nothing. So all my responsibility is off. I don't need to find somebody that's trustworthy. The government did it for me. I don't need to pay for it. The government does it for me. I don't need to make sure it's a good doctor. The licensing board did it for me. And then things go wrong with that physician. So the physician betrayed me. They only want money. The College of Physicians betrayed me. This is a bad doctor. The licensing system betrayed me. They're making money off of me. They're taking my taxes from me. So it's like the church. I go to church, but you don't know that this particular church has the type of people that, are not very good in their members. They're in the clergy that abuse who. So you're going there to listen to what? How do you not know this? So I'm telling you now, you don't know this and you are caught in these places. You're not really, really, really. It's like saying you're not really going to church, by the way. But whoever has discernment, which you lack, because if you're taking the word of the Lord from somebody that hurts the little people, you're not getting the word of the Lord. You're getting the word of Satan, which is to deceive. And if you take pleasure in these things, you are promoting your ego to yourself and you're deceiving yourself in the eyes of God and anyone in the eyes of anyone that speaks the truth. How can somebody that takes pleasure in listening to things that come from the mouth of demons be able to help people fix real life problems? It's impossible. What you will also realize is that these individuals become the tools of mockery. They love to mock the message of the truth. So the basis of all I told you so far is a simplicity unlike any other. It's a naturality. It's a simplicity that is effortless, and you have to accept that effortlessness and you have to practice it. You practice that effortlessness. I don't know how. I actually don't know how. And I dare not say anything about it. I think it is just being yourself. How can you practice being yourself, right? So it's about being honest. You practice being yourself in being honest in your speech. So going within yourself, finding the truth beyond the image. Strength without spectacle. Quiet courage happens when you're standing firm against inappropriate care, advocating despite. Let me explain something that AI cannot explain to you. Conflict. AI cannot explain to you conflict. In fact, before it takes place, because AI doesn't understand the human experience. AI knows the human experience. It does not understand it. Let me explain that in a different way. There's people going to your office that come from different backgrounds, religious, cultural backgrounds. They have a notion of what's right that you may not be sharing. Example, you're a woman, you come from Iran, I don't know, like a very traditional place, and you're the only physician they get to see, but you're a woman, you're blonde, you're wearing a tight skirt, and that patient is there with her husband, and you're her gynecologist. Imagine the contrast. She hides her hair, you show your hair, you wear makeup, lipstick, I don't know what you have. Maybe you have small breasts, or you use a push-up bra or whatnot. But she sees all that and she's not stupid. How is this not an aggression against her? She's struggling to fight for her modesty, and you are basically showing things that she has to compete to some degree against. So she has her husband there. So the question is, should you bring your husband to the hot physician? So think about it. Do you think she's going to come back with her husband in the future? I mean, if she can, right? If she can choose. So let me ask this differently. Will that patient, what if it was a male gynecologist? So now would her husband dislike it? It's like, yeah, male gynecologist. Honey, you're not getting any services in this clinic. We're out. What if it's a beautiful, good-looking, gorgeous Latina physician? What then? That dresses provocatively in their culture, in the culture of the Islamic patient that comes from a very traditional background. So these are conflicts that are brought into, it's the viewpoint of a modern physician from the West meeting a patient from the East that you're supposed to serve, by the way. So how do you deal with that? There is this story in I think, was it Miriam, that there was an angel, I think it was Jibril, that went to, but supposedly in Islam they say that this particular angel was very, very handsome, one of the most beautiful things, or very beautiful angel. And then he approached a woman, and when the woman saw him, she asked God, like, take away this like highly tempting, beautiful individual from my sight, or something like that. I think you Muslims know who I'm talking about. So it's like people, it's like these things leave an effect, an imprint, a thought on people, these experiences, because they come from a different background. If you are on a planet where everybody's ugly and you come here with like good looking stuff, it's like, let's say you went to visit like the Amazonian river people, and you go there with like cell phones, music, stereo systems, refrigeration, food in a can, when they're like breaking coconuts to get water and stuff. Like, I just get my coconut water from my look. It even has coconut pieces inside. This will leave an imprint in these people's minds, right? So these multicultural societies where we are in, communication is paramount to actually having proper relations and helping people. And I think this is such a blind spot in the communication of people right now because they lack simplicity. They actually don't realize to what degree they are hurtful to one another. They actually don't. And I don't think they have the capacity to even care about it. So I leave that up to you. I'd like you guys now to discuss it among yourselves if you want to do a 5-minute exercise about the morality of that. First, of we have an increasing Islamic population. They have children. They have a lot of children sometimes, and they go to see you in the office. And the way you're dressed, is this a proper attire within their culture? And I want you to understand that because we say, the client goes first, the patient goes first. So do they go first? First, do no harm. Who is that harm imposed on and by whom? If you're a female physician in the West, and you have a patient that is niqab, or the most severe forms of Islamic dress codes for females, for women. And her husband is there with her because her husband has to go, maybe because he needs to translate. She doesn't even speak French or English. These are not rare things, by the way. So what should be so who is culturally inappropriate? Is the patient culturally inappropriate in Quebec or in Canada or in the States? Let's say this took place in New Zealand. Is the patient inappropriate in New Zealand? And if that's the case, then the dress code of the physician, which will have an impact on the patient experience, should that be mitigated or controlled? So this is where you guys have to be honest, and why simplicity is better, because these, in your thoughts, you're coming to this conversation and to this exercise with your ego, and that's what you need to get away from. And that's what I said earlier. There needs to be a triage, and there needs to be a solution beforehand, so that people that want a certain type of care, they go to a certain type of place, and this message needs to be prepared beforehand, and it needs to be clear. It shouldn't be found out here that this very good looking blonde physician dresses culturally appropriate in her culture, but really not good in your culture specifically. So that's it for today. We have less than a minute left. Video's about to cut. I hope you guys had a good morning. It's 8:39 in the morning.